Okay, routes of administration. Different ways you can administer medications. We're going to talk about some of the most common ones. So, PO or per os. This is the most convenient form of administering medications for an owner. The thing with PO is it has a slower onset of action. The nice thing about it is it has a longer duration of action. So this is where we can get every 12 hours to give a medication as opposed to maybe every 3 hours with a IM or a SubQ injection. The problem with PO absorption, though, is absorption is affected by the GI system. You need to make sure that the medication you're giving isn't inactivated by the GI system. Absorption can depend on whether they need food. They need to eat food when they're getting the medication, or whether they need to be fasted before they get it. It is relatively safe. Little less chance of overdosing with oral medication. There are fewer adverse side effects with it. Generally, they tend to be more gastrointestinal. Okay. Come in a variety of different ways you can administer medications orally. Tablets, the thing you need to know about tablets is if they're scored, you can cut them. Basically, when a tablet is scored, the manufacturer is guaranteeing that there is just as much medication on this side as there is on this side. So let's say this is a 60 milligram tablet. The manufacturer is saying that 30 milligrams is on this side and 30 milligrams is on this side. If it's unscored, the manufacturer doesn't guarantee the makeup of where the medication is throughout the tablet, because remember, this is not 100% bioavailable. Okay? If it is enterically coated, cannot cut it. There's a reason why it has the enteric coating around it. The company needs it to dissolve a certain way in the GI system in order for the drug to remain active. Obviously, capsules, you can't cut a capsule. You may be able to open the capsule and put it on some food, but again, it depends on why the manufacturer has it capsulized. Some other things you could get: lozenges, liquids. Obviously, a liquid antibiotic, it's a suspension. You'd have to make sure that it's shaken, that it's stored properly. A powder, sometimes there's powders you can put on their food. So there's just a variety of different ways that you can give medications by mouth. So now we're going to talk about the peritoneal routes. The first one that we think of with this would be IV. IV, intravenous, this is rapid onset. It's going to happen quick. When we talk about that peak of the minimum toxic dose in the video about the 3 little bears, this is where your rapid onset of action is at the very top, your peak action. You get a high level of medication very quickly into the blood supply. It's short duration of action, doesn't last as long as, say, giving a PO. Okay, because it's going to be going through the system rather quickly. You can give larger volumes of drug this way. You can give irritating drugs through this route, especially if they're irritating to tissues. If you're giving them IV, they tend to be less irritating as long as you're in the vein. Okay? There is an increased risk of side effects. There is a chance that you may give a toxic dose easier than if you gave something PO. Okay? It does require technical skill. Your average client is not going to be able to give a medication IV. Administration sites, you could do cephalic, saphenous, jugular, though I don't know a lot of people who do IV injections jugular. You should place an IV catheter when you're doing IV injections, especially if you're going to use large volumes. Or irritating drugs, because irritating drugs paravascularly can cause damage to the epidermis. IM, intramuscular, this onset of action takes about 15 to 30 minutes. The rate of absorption depends on the type of drug it is. If it's oil-based, it's going to be a slower absorption. If it's water-based, it'll absorb more quickly. It does have a longer duration of action than IV, but it is shorter than PO or SubQ. You can't use irritating solutions, though you do sometimes use some solutions that are irritating. The pH is a little bit different, so it may cause some stinging. And the great thing about IM is you can use it for fractious animals. If you just get that animal squished down, you can pull a leg out, give an IM injection, and within about 30 minutes, if it was a sedative that you gave them or a tranquilizer, they should be a little bit more handleable. SubQ. This is another very common route. We use SubQ for vaccines. Okay, it's slower onset than IM or IV. It is less reliable though, kind of like PO, where you don't know how the absorption is going to be, and it kind of all depends on the concentration of blood levels we need. It's longer action than IM. You cannot use irritating solutions SubQ. It can cause all sorts of, it can cause skin necrosis. It may cause cancer in the future. So we have to think about not using irritating solutions SubQ. The good thing about SubQ is that we can give large amounts, especially of SubQ fluids that are non-irritating. We can give 100 to 150 mLs under the skin to help with their hydration. Some other peritoneal routes that we may see would be epidural, subdural. Okay, this is rapid onset in the CNS system. Care must be used when you're doing this. Very easy to do an overdose, so you need to be careful of that. You also need to make sure that the medications you're using are sterile, that they are preservative-free, and that the site when you're placing the epidural or doing a subdural injection is sterile. Intraperitoneally, you may see this used more often in lab animals. You do have to remember there is a first pass effect with this, so if it is a drug that is inactivated by being metabolized through the liver, you can't use that drug or IP. You do have to use care with this. You may hit an organ, so you always want to make sure that you pull back. Intracardiac IC, this is rapid onset, has been used in emergency situations. They're kind of pulling away from that now. They do use this in euthanasias. In feral cats, they'll give an IP injection till then they will fall asleep, and then they will follow it up with an IC injection. ID, intradermal, usually this is for allergy testing, though they do some medications intradermally. Slow absorption this way. IO, interosseous, this would be rapid onset. Usually you see this in neonates or exotics. Again, care needs to be given when you're doing this. You need to have sterility when you're giving IO injections. And then the final one we're going to talk about, local routes. There's a variety of different local routes you can give. Inhalation, this has to be volatilized drugs, isoflurane. They can also be drugs that you nebulize or aerosolize, so we use a vaporizer for that. Asthma drugs are nebulized or aerosolized. Topical, there's all sorts of different types of topicals. Ointments, lotions, creams, gels. Topical could be on the skin. It could be in the eye. Pretty much it's a local area that we want to have the drug at. Rectally, these are really good for patients that you can't get IV access for, especially if they're having seizures. You can give Valium interrectally. That can help control the seizures. Really good, quick absorption that way. If they're vomiting and you need to get them an antiemetic, obviously you can't give them an oral antiemetic, but you could give that rectally and help with the vomiting that way. Vaginally, seen mostly with reproductive drugs. Transdermally, these tend to be patches. Medication is infused in the patch, and they are placed on the skin, and then they are absorbed through the skin. Slow onset of action. The good thing about transdermal, especially if you're using something like a fentanyl patch, if you're seeing some signs of distress, you can just yank that patch off, and the absorption of the drug will stop instantaneously. So routes of administration, we have PO, IV, IM, SubQ. These are probably the 4 most common that you will see and be using in practice.